Hello, everyone. Welcome to season two of Health Authority TV. I am Janan Sarwar. I am the deputy editor for Health Authority Books, an imprint and partnership between Indie Books International and Global Bookshelves International. I am so honored today to introduce you to nurse Rosa Hart. She is a nurse, as I just said, a media consultant, and a podcast host, among many other things. Welcome, Rosa.
Thank you, Janan. It's an honor to be with you today.
Thank you. I've loved following your journey and being a part of all the things that you do. And I barely touched on the surface of what you do. So do you mind sharing with the audience, who do you serve as someone that's an authority in the healthcare world?
So, my clinical area of expertise is in stroke. I've worked with stroke patients since 2013, and I'm very passionate about raising awareness around the signs of stroke and when to call 911 for the general community. But I'm also really passionate about educating other clinicians and nurses about how to take care of these stroke patients because if you don't specialize in that, um, it often doesn't come to the forefront of your mind, and you're like, oh, there's other people for that. And stroke is really common. Every 40 seconds, someone in the United States is having a stroke, and it is the number one leading cause of disability in the world. I start talking about this and I kind of get like out of control with it. And people are like, why do you care so much about this? Did you have a stroke? And here's the thing, it's like I've been working with people who've had a stroke for like over 12 years. And in that time, I've known thousands who do. I literally had to start get on anxiety medication because I needed to realize that not everybody does have a stroke. So
Yeah.
like that's just how like permeated my life has been with this, right? So this is very real to me. So that's my area of clinical expertise. And thankfully, I've been able to learn how to speak to them through podcasting to have a better quality of life after stroke, and then also use technology, whether it's social media, podcasting, or developing AI agents to better deliver care and to prevent stroke.
That is fascinating. And, what you've been doing to educate others, whether it's other people in healthcare or individuals in general, right, that have been impacted by having a stroke or knowing someone or trying to be prepared to help someone with a stroke. That's
Yeah.
fascinating in what you do and what you just mentioned, using technology. So I'm really curious as far as the services that you provide, whether it is for other fellow nurses. Can you tell us more about that you've been doing and working on?
Sure. Yeah. So I have worked with individuals to help them start their own podcast or done consulting on how to better use social media, whether it's Instagram or LinkedIn, in order to reach your target audience. And I've also consulted with institutions to create their podcasts like Stronger After Stroke or the Aging Like a Pro podcast out of Miami. And with those, I'm interviewing experts, whether it's clinicians who specialize in stroke, or in the case of Miami, they have their research physicians who are working on brain health and aging and longevity, and or even like people with lived experience, like that's their expertise if it's stroke survivors and caregivers. So, throughout all of that, right now I'm kind of like a multimedia producer because I do a lot of like the recording on my own in addition to um, the content planning as far as what topics are we going to cover and kind of constructing the concepts around that for my own shows. And then I've done more like one-off consulting with individuals um, to build their personal brand. I've actually been working with the American Nurses Association on a course that should come out soon on the uh, building your professional reputation on social media and how that impacts the brand image of nursing overall. And so I'm really excited about encouraging other nurses to use these platforms where they are sharing information to really um, show their expertise and come across professionally. But we need more people to be doing that in an engaging way, spreading good information. Right now, there's a lot of complaining in the medical community about how much faster misinformation spreads than accurate information. But it's all about how you spin it and the delivery of it. And if it's not boring, it can spread. And things don't have to be boring just because they're accurate.
Absolutely. I think one of the things that I love that you do that catches people's attention is, of course, you do podcasts and you are a host of many, as you alluded to a little bit, but just even being able to have these short
Mhm.
clips from the episode that will hopefully lead the people who need to hear it
Mhm.
in, or maybe things people who didn't even think they needed to hear an episode,
Right.
they're interested because of the short clips that you have and the way you're using technology. How did you learn about all of this stuff in social media to become such an expert?
Haha. Well, um, we live in Louisville, Kentucky. That's where you and I met. And I
Yep.
started the Lou Review podcast here with a friend. And through doing that and becoming kind of a foodie influencer in this area, I learned those tools. And I learned that I am obsessed with interviewing people in podcasts. And so it then like transferred over those skill sets. Then I was able to transfer over and merge with the clinical expertise um, to just bridge it off into a different uh, way to help people.
Absolutely. And you're very passionate about nurses sharing their voice. I'm so happy to hear about this collaboration you have with the American Nursing Association. But tell everyone about your book that you've
Yes,
written.
yes. Well, some friend of mine told me I had to write a book. It was you. And I was like, I don't want to sit down and write, but you coached me through it and connected me with other experts. And um, we have this book out now. It's Speak Up, Start Now, that I self-published. And it is to encourage nurses to use their voice. Like if my area of expertise is stroke, every other nurse has a different area of
Right.
expertise, right? Maybe they work with kids or they work with mother baby or ortho, whatever the area is. And for me, with my first podcast, well, with my stroke related podcast that I've been working on, the key there was answering frequently asked questions. What do I repeat myself on a lot, right? And
Yeah,
so I like to encourage nurses if there's something that they're educating people on that they're repeating themselves on a lot, that's a great opportunity to start a podcast because you can record yourself and then share that out. And then you're capturing that expertise and knowledge. And we're losing a lot of nurses from the profession. And a lot of that wisdom is not being passed on to the newer nurses. And so I think it's really necessary for the profession of nursing that we capture that and encourage nurses that what's common sense to them is actually clinical expertise and knowledge that doesn't need to be lost. It needs to be shared.
absolutely. Yeah, it's very powerful, very smart. And it sounds like you take the approach of there's an easy way to
Yeah.
speak up and start now. It doesn't have to be very, very complicated setup and overwhelming. And I think that's what inspires me about you and the way you do things in such a natural, casual, but powerful way. So that's fascinating. What has been your favorite thing you've done through this journey in multimedia?
My favorite thing that I've done was probably collaborating on an Instagram reel with Mark Cuban. Let's be real.
Yeah,
I
that's
mean,
so cool.
I might be able to die happy after that. Um, um, yeah, that's the first thing that comes to mind.
That is amazing. I love that. I love that you're doing this and the power you have to inspire other nurses and anyone in healthcare that you can speak up, you can start now. So I hope people do check out your book. It's available on Amazon,
Yes,
or do you mind sharing your website so people can navigate
sure.
to it as well?
My website is nurserosaspeaks.com, and the book is available on Audible and Kindle at
Yes.
at your leisure. And then hard copies are only available in person, so I can sign them for you. So if you would like me to come speak on Speak Up Start Now and do a keynote at an event, then I can come and bring books and do a signing. I also have been doing signings here locally as well, or when I go to a conference, I like to take copies with me. Then at the last conference I was at, it was really fun because I would sign them on people's backs, and like people say, sign my shirt or whatever. Well, I would like put the book on their back and then sign
Yeah.
it there. It was really fun.
That's sweet. That's so great. I'm so glad you did that. And that is a testament of being able to say, you know what, I am going to use my voice and put it into this book. You've done it on multiple podcasts. You're supporting other people to do it. So here's a fun question. If you had your way and you could redesign the whole healthcare system, what would that look like?
So I have been thinking quite a bit about this with like Nurses Transforming Healthcare, which is a group that I've spent some time speaking with, and building a preventative model built on nursing education and preventative services. I think could make a huge difference in preventing people needing to go to the hospital or preventing their conditions from getting so out of control that they need surgery. And it's like there's a lot of talk around prevention, and I really like the things that I've heard about, like remote patient monitoring, for example, because I think using things like that, like wearables at home to help people really be aware of their body and how their body responds to different foods or activities can be really helpful. But I think that right now it's we have more of a sick care system, and there are some really interesting pilots of programs that are demonstrating what another model can look like of community health with a preventative focus. And a lot of that is, more time with clinicians for education and addressing social determinants of health. Because if people don't have the right nutritional building blocks, how are they supposed to be healthy? They can take all the meds in the world, and that can just create more problems through polypharmacy. So, um, yeah, I think there's some really great things that can be implemented that would not necessarily have the same profit structure. And so that would be a big change, but I don't think it's impossible.
Absolutely. And it gives a role to so many different people, whether
Mhm.
it's the nurses or empowering the patient is what I'm
Mhm.
hearing, right?
Yeah.
For a preventative model
Mhm.
instead of these disempowered individuals who are being supported. I mean, I think there's different ways to do that, and hopefully we can get further and closer to that. And
Yeah.
I hope so.
Yeah.
Well, this was amazing. I love what you do. I hope people follow you on what are
Likewise.
the best ways that people can reach and connect with you.
So I am on all the social media platforms at Nurse Rosa Speaks, and I'm on LinkedIn as well. I love using that. I would love it if you would interact with me on the Nurse Rosa's Insights podcast. If you want to listen to some episodes and leave a comment and subscribe there, I have really been enjoying interviewing healthcare stakeholders and getting their answers to the billion-dollar question of
Yeah,
how we can build new solutions that can have a sustainable effect on improving things. And I think you'd be interested to hear some of their ideas.
absolutely. We're going to follow along. Thank you so much for your time today. It was wonderful hearing about all the things. We'll make sure in our caption below, we'll have all ways to connect with you and follow you. And for everyone listening, thank you so much for listening. Until next time, may you be healthy, wealthy, and wise. See you next time.
Thank you.